So today I'm going to be talking to you guys about osteoarthritis. In Latin, osteo means bone, arth means joint, itis means inflammation. It is essentially a wear and tear or a degenerative condition that occurs in the joints. Now, a joint is where two bones come together. So what are some of the risk factors involved? It can happen as we age. It can happen due to genetic factors. It can happen if you've had a prior injury in a joint. It can actually happen with extra stress on the joint, so in the setting of obesity. The tough part, there is no cure for it. It's a process that sometimes we cannot stop and that we cannot reverse. The knee is probably the #1 joint in which I'm diagnosing osteoarthritis. It can be a really tough diagnosis to deal with. Patients are coming in with pain, swelling, stiffness, and overall dysfunction in their knee, which pretty much affects their daily life and affects their ability to be active. It's pretty devastating for patients who have led a life that's really active. And so they're coming to me looking for help and ways that they can get back to that active lifestyle. I always show my patients their x-rays and give them a visual idea of what's happening in their joint. We're gonna go through an x-ray right now so you can see what's happening in a joint when there's arthritis. Let's go through some x-rays to explain further what's happening in the knee. This is a normal x-ray of the knee, looking at it straight on from the front. Here's some general anatomy terms. Here you can see the patella or the kneecap superimposed over this larger bone here, which is your femur or your thigh bone. And here are your lower leg bones, your tibia and your fibula. Between the femur and tibia sits the joint space. The joint space is where the cartilage or the soft tissue in the knee sits. This is empty space on an x-ray. You can also appreciate that the femur and the tibia sit one on top of the other. Overall, you can see that the bones are smooth with pretty much a uniform color and appearance. This is a pretty good looking knee. Let's move on to an x-ray with osteoarthritis. Pretty drastic difference compared to the x-ray we just reviewed. You can still see the patella superimposed over the femur and the lower leg bones, the tibia and the fibula. However, the alignment of the femur on top of the tibia is slightly shifted medially or to the inside of the knee. This is because the femur is shifting slowly over time as osteoarthritis develops and progresses. Let's go over the 4 changes seen in the joint that your healthcare team will use to diagnose osteoarthritis. #1 is joint space narrowing. Remember, the empty space between the femur and the tibia represents cartilage. As the cartilage wears down, the space narrows and the femur and tibia sit closer together. #2 is the development of rough bony changes on the edges of the bone, known as bone spurs or osteophytes. You can see these larger ones here in the lateral aspect of the knee, and these smaller ones here on the medial aspect of the knee. #3 are these sclerotic or white changes to the bone here. This represents that the bone is becoming more thickened, hardened, and irritated as the cartilage wears down. #4 is a bit harder to see, but are these darker, more cystic changes in the bone. Not only can the bone become more hardened and white appearing on an x-ray, but the bone can also become more softened. Here's a recap of the 4 changes seen on an x-ray in osteoarthritis. Joint space narrowing, bone spurs or osteophytes, sclerosis or thickening of the bone, and cystic changes or softening of the bone. All of these 4 criteria can be present, but you don't need all 4 to be diagnosed. Many times 1 or 2 of these changes can suggest osteoarthritis. These 4 changes can happen as the soft tissue in your knee, known as the cartilage, which acts as a cushion between the femur and the tibia, starts to wear down. Eventually, this can lead to bone-on-bone arthritis, which at that point, the cartilage has completely worn away. Your doctor, surgeon, or other member of your healthcare team may order x-rays if you're having joint pain and can go over your x-rays with you. If you like this video and are interested in more content like this, please subscribe to my channel. I'll see you in the next video.